Hello everyone, and welcome to another episode of Ask Dr. Bob. And we have some very interesting questions that I know will make a huge difference in your life. Someone from Vancouver asked me a question in reference to a condition called Granuloma annulare. Now, any kind of skin lesion, and I did a little bit of research on this, is a benign lesion of unknown cause. A lot of times they'll use that term idiopathic. And as I was reading through, I saw that they mentioned that it could be a virus-related possibility. Anytime that I have a skin lesion when somebody comes into our practice, we always think about liver being number one. But I want you to know that yesterday I had an individual came into our office and she was having cysts throughout her body. And as we had conversation, I discovered that she worked as a volunteer at the Animal Protective League. She happened to have some cats at home. And what I have learned recently, and there was an article in the Wall Street Journal called Cat Bites, that was talking about a condition called toxoplasmosis gondii. You might say, what does that have to do with granuloma annulare? Anytime that somebody has possibility of parasites in their body, they could have skin lesions of an unknown cause. So I would encourage you, wherever you're at in the world, if you have skin lesions, after you fix the liver that continue, please be checked for parasites. You can contact us on our website. We have kits that we can make available to you to do a study of your colon and your stool. Dr. Bob, what do you recommend for hepatitis C? Well, there's a variety of products, but anytime you have hepatitis, as you know, it involves the liver. There's a product that is available at most health food stores, and we also use it from a company called Gaia Herbs called milk thistle. Silymarin is just a name of the herbal name for that, but we really focus on vitamin C is really important for the liver. We use a product called MCS2. I personally take dandelion root. So you want to be consistent with liver cleansing herbs, nothing real harsh, nothing real hard. A lot of times there's some very dramatic herbs that you might just consider staying away from. You could feel comfortable and say milk thistle, something with maybe glutathione in it. I'd also eat eggs, onion, and garlic. Those are sulfur-based proteins, important for liver function. I was wondering if you could help why the reasons that women tend to cellulitis and what can you do to improve that. So I wasn't sure if it was cellulitis or cellulite. Cellulite is a deposit of toxins in fat in a person's body. And I'm not saying that women tend to be fatter than men, but their body distribution of fat is a little bit different. Cellulitis, on the other hand, is just inflammation of those blood vessels in your body. And actually, at one time, I had that from a spider bite. Cellulite, accumulation of fat in the body, toxic. Cellulitis, a variety of possibilities. Make sure you're taking enough vitamin C and use enough oil, minimizing inflammation. Dr. Bob, this is a very excellent question. Is iodine a good supplement for Hashimoto's? Well, the jury is still out on that. We have had some individuals that will use low dosage iodine with great success with Hashimoto's. Hashimoto's is an autoimmune problem. Now, Dr. David Brownstein, who's an acquaintance of mine who endorsed one of my books, he says, you know, it's 6 to 1, half a dozen the other. He wrote a book on iodine. It all depends on the individual. I would start treating Hashimoto's no gluten, no sugar first. We have found great success with selenium, and we use a emulsion forte, 4 drops 3 times a day. Once again, thank you for the questions. We thoroughly enjoy them. Please pass this on. We want to make a difference in someone's life.